website. And I just have one final question actually for both of you, and I will go ahead with Dr. Sandberg since he's been talking for these last few minutes, because this is more of a continuum. And my question is what do you believe is going to be the future of your specialty and your contribution to the health of men?
Yeah, I mean, I think that, the future of our especially of urology in general is going to continue to be not only prostate cancer treatment, but recovery. And the MIU Men's Health Foundation is absolutely a leader in that. And I think everything that the foundation is doing right now has done in the past is only going to help men continue to ensure that they get the best treatment possible. So that includes research, it includes funding for new therapies that I think are going to end up being very different 20 to 30 to 40 years from now than they are right now. But also better treatments and therapies for those inevitable side effects when they come.
Thank you. And Dr. Schaffner, your thoughts?
What I think will happen with my profession is as access to my profession grows and the awareness of what physical therapists, what our education is and what we really know, I think that patients will start coming to us sooner. They will start coming to us, before it's been years. Maybe it's after they've already been discharged from Dr. Sandberg or somewhere in between. They'll come to us directly once that's enabled in this. What we can already do that a bit, but I think that's what's coming is they can come directly to us. They don't have to ask a physician's prescription or permission or anything. And we can evaluate where they're at in their life and make recommendations. And those of us who are appropriately trained in pelvic floor physical therapy and have the experience to know what our limitations are. When I look at how my field has changed over the years, the body and way muscles work hasn't changed a ton, but our knowledge of how it works has. And so we've got different tips and different tricks and different techniques to help get patients onto where they need to go. And I think it can become a far more collaborative experience where right now I see a lot of patients from doctors to me, where I think it might come the other way around, where we are actually seeing patients sooner. Maybe we're seeing them even earlier just with some of the occlusive problems, and we are actually sending them to you guys. And so it becomes a little bit more of a two-way street in that matter. So just earlier care, earlier intervention.
And I really do want to thank both of you because what you've actually shared with us tonight is about being proactive and integrative and how it can be helpful to patients pre and post treatment. And I think that really is something that we should all focus on and try and be better at. And I know that we have not done as good a job as we really can. So hopefully in the future we shall.